All right, it's good afternoon. So yes, very humbled to close out this panel with another experience that's a little unique. My name's Mary Krueger, and I've had the opportunity to be in the Army. And I started out not at all thinking I was ever going to be a flight surgeon. So my first question is, how does one get from here? And you don't have to comment on the hairstyle. It is the short white coat. So this is me as a med student. My very first rotation of my third year, wet behind the ears. I was an Army scholarship recipient at this time. Paulette mentioned uses. The other way military physicians come to be often is through something called the Health Professions Scholarship Program. And when I graduated from college, my 6'6" tall engineer dad had a little tear in his eye, and I thought, wow, look, he's emotional. It was a tear of joy because he realized he was never paying for anything for me ever again. So that led me to seek out employment elsewhere. And although nobody in my family had ever been in the military, I went through the Army scholarship figuring twice a year somebody would tell me to stay fit, be a healthy weight. I'd have a guaranteed job when I get out. And like Paulette, I would be paid during that time. So how do we get from this, chubby-cheeked, wide-eyed, to a flight surgeon who had a chance to plan the entire medical plan for our transition out of northern Iraq. So, and it is. And I wish I could say I had credit for it, but really it was a lot of great opportunities and a lot of what the speakers have said today, being willing to take those chances. Don't be afraid. Trust when others people say they think you can do it, you likely can, and even more. And so I'm just going to share with you a little bit about what that looks like for a flight surgeon. So I started out my training pretty normal. For those of you who, like me, thought Army medical centers were concrete cinder block buildings, this is Madigan. That's where I did my training, a gorgeous place when you're doing rounds at 5:30 in the morning. The sunrise over Mount Rainier is amazing. Delivering babies, family physician. I got into the academic piece, but by third year I was kind of sick of doing regular rotations, so I made up an infectious disease rotation. And when you're in the Army, that means you could hop on with some special operators and go to Africa. So I went to Eritrea, Africa for my infectious disease rotation. I did have a curriculum, I wrote it up. But I had a chance to work with the providers there, and I was able to understand how health could really be a stabilizing force in areas, because if people are healthy, they're fed, they're educated, they have governance, they're much less likely to be susceptible to terrorist ideology. And I thought, this could be fun. I could really enjoy this. So I went back to my academic medical center, Ivory Tower, and that seed had been planted, but I got back there, and so I got more involved in research. The Army paid for me to do a master's in public health at UW. And so while I took those experiences, I kind of slid back into the academic realm. But then 9/11 happened, and our world changed forever in many ways. And for me, what that meant was I had the opportunity to deploy to Afghanistan, and I got the word in 2002. Actually, somebody heard it in the commissary. That's what our shopping areas are, grocery stores, that somebody from our department was going to Afghanistan, and I got to find out it was me. So I went from being this really academic person that people thought of as the faculty development residency director person to being somebody who was operational. And so while I was in Afghanistan, I did trauma for a few months, and then I actually joined up with had the opportunity to serve with special operations and take care of soldiers one-on-one and fly a fair amount. And I said, when I come back, this is the route I want to go. And as Paulette said again, you have a chance to recreate yourself. And so that's what I did. So I went and from my ivory tower, and I went and found the helicopters. And this is the majestic Black Hawk, one of the most reliable forms of air transportation you want to have to be able to get places in the mountainside, to be able to get to remote areas, and for our purposes, to get patients out of harm's way. So this is me at the flight surgeon's course, and what you do as a flight surgeon is you really get to do a lot of the things that the pilots do, because your job is to keep them healthy. And in order to understand what they need to do, you get to experience that. So we got to do the dunker training. So one thing that helicopters do is they fly over water. And you want to make sure that if your helicopter stops flying when it's over water, you know how to get out. So this is called the dunker, and it's exactly what it sounds like. It's an airframe that actually gets dropped into the pool and turned upside down with you fastened into it. Very safe. We have divers around. And they help you get out. So that helps you to understand some of the psychological measures for pilots and crew members. It helps you to understand some of the tactile things that are necessary, and it helps the pilots respect that their docs have been through what they've been through. The other thing that we have to be experts on is altitude medicine. So we get to go into the chamber. And so the chamber is a room that will take you up to feeling like you're at 30,000 feet. And does anybody know what's really decreased at 30,000 feet that might be important to us as human beings? Oxygen, exactly. So what you see there in the lower corner are two of our students finding out what their testing performance scores are without oxygen. And so we do this as doctors too. And it's so funny to watch. You think you're doing things completely right, but somebody is writing something on your paper that is not completely right. So these are our patients. And who you're looking at right there, CW2 Jessie Russell. So just so you know, we have a lot of female colleagues that are also flying. I used to love it when because once you got all this stuff on, you can see you're not real recognizable, but when you see the big ponytail sticking out the back or the big braids sticking out the back, you know who that is. So you got to make sure they're healthy enough to fly because you're flying in the back most of the time, so it's you as well. You also have to mix that care with the dust-off bravado, because these guys, if you'll excuse my language, after being downrange for a little while, think they're pretty badass. And actually they are, because they have been part of the reason we have the highest survival rates in history. Our survival rate's 97%, and with some of the most lethal weapons on the battlefield. So it's pretty amazing, that technology that we're able to put in the back of the aircraft, but without our crew members and our pilots, the technology is worthless. So I was able to apply this training in northern Iraq. That is the main palace in Baghdad. These are some of the folks that I had that were able to help make that happen. Logisticians, pharmacists, psychiatrists. Our therapy dog, by the way, that is one thing I will say as a female, you bring a little different flavor sometimes. We were the only division to take a therapy dog with us. Most therapy dogs live with the medical units in the hospital, but Rose lived with us, so soldiers didn't have to be sick to see her. So this was our job. All of northern Iraq, we had to make sure that there were enough aircraft placed in the right places, enough surgical assets, that no matter where a soldier got hurt, within 1 hour, we will have picked them up, gotten them off of the hot zone, we will have gotten them packaged, and gotten them to resuscitative surgical care. One of the perks of being a flight surgeon is you have an awesome office window view. So these are some of the areas, because when I had to go and make sure the medical care was taking place, I actually went out to those sections. No matter how small the flight area, no matter how small the aid station, I went out and made sure those medics and PAs were getting what they needed to make sure they had the supplies. It happens. This is a forward surgical team, believe it or not. This is where we do our surgeries, resuscitative, meaning stop the bleeding. So that's where our resuscitative surgeries take place. And this is here is highway, so after they've had their resuscitative surgery, the patients are unloaded here and gotten into our medical center where we can actually do further care to take care of them. Other privileges as a flight surgeon, you get to work with local healthcare personnel and learn about their systems. You also work with international partners. This was our Fijian PA who took care of our embassy personnel. And then following that, I also had the opportunity, now that I come back, you'll notice that doesn't look like Iraq anymore, that's Hawaii. So once you are able to perform this sort of duty at that level, you get other chances. So I had the chance to command a clinic that took care of about 35,000 people in Honolulu. I now work in policy, so my office is in there somewhere. Now, there are sometimes challenges though, I'll admit that. This is my oldest son's first day of kindergarten. So his sign says, you know, love mom, first day of kindergarten. But the rewards are coming home and the welcome home. And just so people ask, how do your kids handle it? You notice their welcome home is, hope you had a good trip. It was 13 months, but to them, that's what mom does. She went on the trip. So I want to thank you for the chance to speak with you about it. And again, hopefully that gives you a little insight into what flight surgeons do.